That's starting in 2-1. Go.
Hey, good morning, Daniel.
Hello.
Hey, nice to meet you.
Yep.
So, Daniel, what brings you into the clinic today?
My hip's been hurting a lot. Nothing like out of the ordinary has happened,
Mm-hmm.
but I mean, I'm getting a little older now, and I'm trying to play basketball still,
Okay.
and it's definitely not working like it used to.
How old are you, by the way?
I'm turning 66,
66?
at the end of the month.
And then who are you trying to play basketball with? Do you have grandkids or?
Oh no, I have some friends from high school. We still
You guys still in
play.
touch?
Yeah, we still
Yeah,
play
that's
like maybe once a week or so.
once a week.
Yeah.
Oh, that's very rare that you kind of stayed high school friends for such a long
Yeah.
time.
It's crazy.
I'm sure you're very thankful for that.
Yeah, definitely.
So you said you started getting pain playing basketball.
Yeah.
When would you say the pain started to occur?
I last month I noticed it the most prominently.
Mm-hmm.
I didn't do like any like weird movement, but it just started really hurting. Mainly in like the front of my thigh and then even in my groin area.
So it's the right side there?
Yeah, it's the right side.
Okay. And would you say it's gotten worse since that last month?
Yes, but not like significantly. It started pretty prominently.
Mhm.
Like, yeah.
Okay, and as far as like the pain here, what would you say like the main complaint is with the pain?
It kind of feels like sharp, like stabbing.
Okay, and is that pain constant or is it just sometimes when you do certain
Um,
movements?
I mean, I can feel it like right now, but it's
Uh-huh.
not too prominent. It's pretty low.
Mm-hmm.
But like when I try and play basketball, then it gets pretty severe.
So it kind of aggravates you a
Yeah,
lot.
exactly.
Okay, and then what would you say your pain is at best? So like from 0 to 10, like is it ever 0, like meaning no pain, or 10 it's like
Occasionally,
excruciating?
but usually I do feel like 2.
Like a 2?
Mhm.
Okay, and then what's the worst? Like say when you're playing basketball?
Probably like a 6
6, and then what would you say it is right now?
right now. 2.
Okay, and aside from basketball, are you currently working?
No, I'm retired.
You're retired?
I do a lot of gardening,
Okay.
and it doesn't hurt as much as basketball, but it does bother me.
Oh, what do you do for gardening? I recently got into it. I started growing chili peppers, some watermelons, and
And
cucumbers.
I usually do flowers,
Well,
to
what
be
kind,
honest.
what
Yeah.
kind of flowers?
Like dandelions, daffodils, all that good stuff.
So you're pretty familiar with flowers?
Yeah.
Maybe you could help me with my tulips because they're not really growing. I planted them I think I planted them 4 weeks ago.
Yeah, it takes some time.
It takes some-
There's a lot of learning you need to do, for
Mhm.
sure.
Yeah, if you have a website, maybe you can show me so
Yeah.
I can look it up later.
Definitely.
All right. So I know you said like basketball kind of hurts,
Mhm.
right? Does it also affect you with your gardening as well?
Yeah, like I said, it doesn't hurt as much, but basketball is definitely the worst.
Okay. Is there like a specific motion you think you can kind of pin down when you're playing basketball, or is it just like the constant
Probably,
running,
yeah, jumping
jumping for
the
sure?
most.
Uh-huh.
Just bringing that knee up.
Okay,
The higher I bring it up, the more it hurts.
gotcha.
So I try and avoid jumping.
Okay.
Yeah.
Anything else with any other hobbies?
No.
Okay. And then what are you trying to do right now to kind of mitigate the pain?
Um, just resting during the week.
Mhm.
Trying to build up to where I can still play. After I play, I usually ice it, and that's about it.
Okay, so you're still playing basketball even though it hurts?
Yeah.
Got it. Okay, I know you said it's pretty painful when you
Yeah.
play basketball. Does that ever affect your sleep schedule?
No, it's usually pretty. It usually calms down at night.
At
Like,
night.
like I said, when I ice, I'll just like lay down and relax.
Okay. Do you do it like? Do you take anything other than icing? Do you take any medications for the pain?
No.
No. All right. Then what would you say your overall general health is?
I have high blood pressure.
Okay.
But other than that, that's about it.
Okay. Would you say you're a pretty healthy individual?
Yeah, I try to be.
Try to be. It's hard sometimes, especially with all the good food.
Exactly.
Do you know if your doctor required you or got an X-ray for you, an MRI?
Yeah, we just did an X-ray so far. He said he
Mhm.
saw like a couple abnormalities, so he wants to do an MRI next.
Do you know when you're gonna get the MRI?
Next week.
Next week.
Yeah.
Cool. And then, do you have any past medical history, like any surgeries or any past ailments
No.
that you can think of? That's it? Okay.
Mhm.
And then what is your goal? What is your primary goal out of physical therapy? What do you want to get out of it?
I want to be able to play basketball again.
Okay.
Like I said, I'm still going, but I know that's probably not the best for me, so I
Uh-huh.
would like to be able to play without any pain.
Yeah, maybe we can take it easy for the next couple of weeks and kind of reduce your pain before you start playing again, just
Yeah.
so it doesn't aggravate the groin pain that you are currently experiencing.
Okay.
And before we get started on the intervention, you said it's the right hip,
Yep.
right?
Hmm.
And then, can you point at the area for me?
So it hurts right in the front, and it also hurts in the groin area.
Okay.
Yeah.
All right. Thank you. I think this will do for the evaluation portion, and we'll get started with the intervention.
Sweet.
Were you trying not to laugh the entire time?
Huh?
Were you trying not to laugh?